And still keeping with health-related matters, Akwa Ibom State Agency for Control of AIDS, in collaboration with State Ministry of Health and Excellence Community Education Welfare Scheme, has organized a 2-day capacity building workshop aimed at strengthening community efforts in prevention of mother-to-child transmission of HIV. Speaking during an event, Program Manager AKSACA, Dr. Enobong Apan, stated the essence of workshop was to share knowledge, identify bottlenecks, and co-create solutions that would strengthen community-level mother-to-child transmission models. He disclosed that between January and April 2025, more than 200 pregnant women tested positive for HIV and also highlighted ongoing challenges, including late uptake of antenatal care, persistent community-level stigma, and poor retention in care, especially in rural and hard-to-reach communities.
Akwa Ibom journey of HIV so far has shown that we are almost achieving epidemiological control in the adult population in the PMTCT program. So this event becomes more crucial and more critical. While we have made commendable progress with a 98% linkage to care rate for HIV positive pregnant women in our states, there remains significant gaps, especially in the number of pregnant women who had hospital delivery.
Workshop also amplified community voices as Mrs. Elizabeth Udo, coordinator of Network of Persons Living with HIV/AIDS, as well as Dr. Ngozi Nana, team lead at Heartland Alliance, called on mothers to become advocates for HIV prevention, cautioning against risks of self-medication.
So what am I trying to do? We are going down to educate, to sensitize, to prepare our mind to all the things. For us, whenever you talk about strengthening or anything that has to do with state actors, community level, for us that's actually the way we should be going. When the PM was speaking, he said something about donor funds drying up, and that's the truth. So we want to see how we all can work together, how we all can put our sources together, irrespective. Everybody has something to offer. If you don't have money, then you have your time. If you don't have your time, you have your energy.
Participants at events commended the initiative and pledged continued support towards achieving an HIV-free generation in Akwa Ibom State.
As a state, we're supposed not to by now register positive children because we are looking at HIV-free generation by 2030. So today now is 2025 and we still have new infection from the state. So my motivation is for me to come in, achieve the knowledge on how to intervene in the community with those positive mothers and how to track and mobilize them, make referrals to the facility so that we can have negative children.
And running the test will help us to identify the cases that we have so that we can be able to educate them, tell them that this disease is not a deadly disease, that they should be encouraged to come out and accept it so that we can lead them to the facility for them to be enrolled and get their treatment so that they will give birth to a negative mother like I did on my own.
Many of us were not aware of this, and that also enlightens us, whereby we can be able to be, I call it updates, to the present state of Akwa Ibom State status concerning HIV and AIDS.
The workshop is part of broader efforts strengthening synergy between government, non-state actors, as well as communities in fight against HIV/AIDS, especially among vulnerable groups.